Gardens to me matters because it brings normality. It gives a little bit time to put my guard down. I don't see myself as different from another person. It brings that normality and a stable plane for everyone. I'm Mansoor and I'm part of the Live Experience team at Pathways.
Pathway is the national homeless health charity. We work within and alongside the NHS to improve care and health outcomes for people experiencing homelessness. In many ways, what we do for people working in the NHS is create networks of recovery and growth around people coming into care, coming into hospital off the street. The teams work to create relationships of care and to connect people into services. And for our teams, it's vital to connect services around people, and to listen to the person and to build recovery and bring people back to health.
So I face the same obstacles and challenges that I'm trying to help give my insight into. So when I speak to the Pathway members, they personally, on a one-to-one basis, sits with me and signposts me and also guides me into how I can help myself and motivate myself into getting into progress in life in general. Pathways work with homelessness and health, and I would really like people to learn from us and support us in our work.
The design has been influenced by Pathway using 3 pillars: sustainability, networks and connections, and pathways themselves.
The positioning of the walkway is a journey through the planting. The planting isn't really arranged in a specific way. It's woodland-like, but the planting's also very, because we're at Chelsea, it's a little more intentional. So it's a bit of a garden, but it's also a lot like this, where it's a bit unintentional, but still with a bit of interest and oomph for the show itself.
We're using all reclaimed materials, and we're trying to be as environmentally friendly as possible. And also we're using waste from last year's Chelsea Flower Show to grow the mycelium, so we think that's a perfect circle. Mycelium and mycorrhizal networks are underneath our feet. They're everywhere. They're probably spreading out far and wide beyond this forest and woodland that we're in. And those networks and connections that nature uses are very relatable to Pathways work. So although the structure in the garden is going to be these big monolithic structures that come out of the ground, the key metaphor is the networks and pathways beneath our feet that we sometimes are not aware of and that are so life-giving and important.
In here we've got the substrates. There will be all manner of small cavities between the particles of wood chip that we've got here. So the mycelium will fill all of that and it will essentially glue the whole thing together. So we're ready to put this tray in our growing chamber, and it will not be touched now for a period of time for the mycelium to grow, fill in all of those microcavities and turn each shape into one solid part. We're left with a relatively strong, light, 100% natural product which can perform any number of functions.
Pathways really is the lived experience journey and how those people transition from a situation where they are homeless to accessing better healthcare and then to a secure homed environment. And the way in which pathway is illustrated in the garden is the actual pathway. The first part of the path is difficult to navigate, there's slight obstacles, and then you go round to the physical obstacles, which are the mycelium structures, and then you turn a corner on the path and go to an easier area, to the bench and the pergola and the reflective pool, which is a point of rest and recovery, and then out into a garden, a much wider, more accessible route out of the garden.
So our Chelsea garden is moving to a place called the Shekinah Project in Plymouth. It's going there because we have a clinical team in the hospital in Plymouth, and they work very closely with the centre to support patients as they're coming out of homelessness into recovery. And we hope the garden will be that focus for people's recovery and their journey, their pathway back to health.